So today is the first of 2 days looking at these projects that we've had brilliant funding from Macmillan for, up to £300,000 pledged for a number of projects, and this is the first day hearing about half the teams and what they've been up to, and we're looking forward to the next one in October to find out what good work they're doing too.
The Innovation Fund was proposed by Macmillan Cancer Support, and they gave us over £300,000 for the tumour pathways to have opportunity to put in bids. And these bids were to show how they might take an element of the recovery package to equip people for life after cancer, or to explore new ideas, innovations.
My project was a joint project with the rehabilitation team, and it was to encourage people to add in exercise into their daily life. So it was a walking programme. Walking's really cheap, you don't need any equipment to do, and you can fit it around your life, your appointments, your treatment.
Well, our event involves helping to manage patients with complex problems that have arisen as a result of their urological cancer treatment.
We felt it was important to offer something to secondary breast cancer patients, so patients for whom their cancer has spread to other areas of their body, because when it comes to health and wellbeing events, in the UK, they're predominantly for patients with primary breast cancer, and we felt that this patient group had a different set of needs that we should acknowledge.
I think the funding's been absolutely invaluable, because often where there's great enthusiasm to start an initiative, the ability to actually have some resource carved out that's dedicated to get something off the ground is often missing in the NHS, and so some of the good ideas can founder because you need to test something before you can actually secure resource to make something happen. But of course, if you've never done the test, you can't actually make the case, and this is a start to being able to make the case that some of these projects could be a difference that really makes a difference.
We are aiming to introduce a new pathway for patients whom we are starting on hormone treatment, and as a result of the hormone treatment there will be major consequences on bone health, cardiovascular system, as well as major metabolic changes in those patients. So our aim is to identify those patients at risk and try to reduce the risks as much as possible.
The project that I led, along with my project manager, Jackie Routledge, was to look at providing education for healthcare professionals about the long-term consequences of pelvic cancer treatments. The project was in 2 parts. One was about face-to-face learning, and the other one was to develop e-learning so that we had a sustainable educational resource.
So the project that we ran with Macmillan Innovation funding was a pilot project for a year to implement health and wellbeing events for patients affected by head and neck cancer. So it was about we ran 4 events over the duration of the project and invited patients along to give them information and support to help them transition from the treatment phase into the survivorship phase.
From attending today, I can see that there's a lot of gifted, experienced professionals that are really dedicated to improving the lives of people affected by cancer. But in their clinical roles and day-to-day responsibilities, they may not necessarily have the room to innovate services because they haven't got the time. So I think this funding's given them that opportunity to step back and develop and innovate.
It's looking about doing things differently. It's about working with people affected by cancer so they can channel in their experience and come up with ideas that otherwise we wouldn't be thinking about.